RTI worked in the Philippines since 1980, and in one way or another, the various engagements that we had have to do with supporting health system, decentralization, devolution in so many different ways, and private sector engagement as a cross-cutting area. It's the formation of the service delivery network came initially in support purely from the perspective of improving efficiency of health services and quality, and ensuring that the patient is seen at various level of care and get what they need uh, in the most efficient way possible. When I came in 2019, everyone was talking only about the clinical technical side, and that conversation about how do we fund the services, how those are the patient circuit between levels is going to be managed, how the emergencies are going to come in, what's the role of primary care as a gatekeeper, and how some of the um, operationalizing those integration efforts between the various providers were missing that financing component. And coming from Eastern Europe, where we went through reforms since 1990, when when all the former Soviet Union collapsed and the revolution. I mean, for like 10, 15, 20 years, and I could say even now, those reform continues. That brilliant idea of a special health fund, which actually it's in a different ways, you see it in a lot of the European countries. Those financing reforms are extremely, extremely important to give the health system actually another impetus on primary care, on prevention, on talking about that public health and public health outcomes overall.